Hi, I'm Dr. Raajam Murali. I'm a senior consultant of infertility at GarbhaGudi IVF Center, Hanumanthanagar, Bangalore. Today, we'll be discussing about the topic of embryo freezing. So, embryo freezing is done after IVF in certain conditions. So, when you get more number of eggs, you are at a risk for a condition called ovarian hyperstimulation syndrome. Suppose if you are at a risk for ovarian hyperstimulation syndrome, the doctor may tell you to freeze your embryos than going ahead with a fresh embryo transfer. And embryo freezing, the success rates of an IVF cycle after a fresh transfer and after a frozen embryo transfer are almost the same. Even frozen embryo transfer, sometimes the pregnancy rates are higher than the fresh embryo transfer. And in conditions where the endometrium is thin during an IVF cycle, or when the hormone levels are too high or not correct for an embryo transfer, we freeze the embryos after an IVF program. Also, in conditions where a pre-implantation genetic screening or diagnosis is required, where the embryo is biopsied and sent for testing, the biopsy result takes about 2 weeks to come back. So, till that time, embryos are frozen till the report comes, and depending on the report, which embryo to be transferred is decided, and later a frozen embryo transfer cycle is planned. Embryo freezing is also done in cases of fertility preservation. Fertility preservation in cancer patients undergoing chemoradiation. Suppose a young woman or a man in her reproductive age group is undergoing cancer chemotherapy or radiotherapy, their fertility is lost after the chemoradiation. So the cancer oncologist usually refers patients for fertility preservations, in which the eggs and sperms are retrieved and made embryos and frozen. So once their fertility is preserved, they complete their cancer treatment, and once they complete the cancer treatment, they come back and use these embryos for getting pregnant. Embryo freezing is also done when you want to preserve your fertility because of social reasons. Suppose if you have personal or professional commitments and you do not want to conceive in the next 5 years, but you want to preserve your fertility, you can either freeze your eggs or embryos, preserve your fertility, and later come and use these eggs or embryos to become pregnant. So these are the conditions where the embryo freezing is done. And embryo freezing is done by a process called vitrification, where the embryos are exposed to a cryoprotectant, and then they are kept in liquid nitrogen at minus 196 degrees centigrade. Usually vitrification programs will give 99.9% survival rate. That means when an embryo is frozen by vitrification, 99.9% of the times when it is thawed or brought back to the normal temperature, it survives, and the success rates are almost same or even better with frozen embryo transfers. And embryos can be stored in liquid nitrogen for a period of about 10 years. Thank you.